I'm Jermaine Daming, and I'm going to do a little rundown of my shadowing experience at Chandler Hospital. So I got to shadow a CRNA named Eric Toohey. He got to show me his routine of the day, the machine that they use, the 3 gases that they get to administer, as well as the other medications that they use. I also got to see how they intubate the patients and other stuff. So speaking of intubations, when I went to the OR yesterday, I got to talk to a CRNA, and she got to actually give me different intubation blades. So this is a Mac blade. It's curved and it also has a flashlight. So you would just put this down the throat to help intubate, and then this is a Miller blade. It's straight compared to the Mac blade, and the only reason you would use one over the other is for personal preference. The difference is for the location that you would insert it. One is over the epiglottis, and then the other is between the epiglottis and the vocal cords. When Eric was showing me his intubation, I got to actually see the epiglottis and the vocal cords, which was really awesome. So that's a big part of their job. A big thing that they have to do every single morning before each surgery is they have to turn on the machine and make sure that everything is functioning. They have to hook up all of the wires to be able to see vital signs, see the heart rhythm strips. They also have to make sure the tubing is working to administer the gas volume. They have to make sure the airflow is correct, as well as the mechanical pump and so many other things. But that is the first thing that they have to do to make sure things go smoothly and functioning for surgery. A big thing that they do as well is, well, for Eric, he has a certain routine before every patient. He draws up his meds for every single surgery before he sees the patient so that he's prepared and ready. He actually let me draw up 2 medications. One big one that they use all the time is propofol. It's the white medication. One key thing of medication administration is obviously to administer the correct amount that you're supposed to give, make sure it's the right medication, go through all of the 7 rights. And also, before you give the medicine, you have to tell the patient what it's going to do to them, as well as if it burns or if it gives a salty taste in your mouth, you have to let them know before you give that. So that's a good teaching lesson that CRNAs have to do. Another great thing is during the surgery, they have to monitor. That is their main job, is just monitoring the patient, making sure everything is aligned. They have to also multitask. Sometimes they told me when they're having a sickly patient, they have to give blood while monitoring vital signs, while listening to the surgeon, and giving other meds. For a healthy patient, they kind of just have to monitor, make sure everything's okay. But you always have to be aware in case of the surgeon needs anything from you. Like during one surgery, the patient started to twitch and kind of started waking up a little bit, so he had to give more medicine. So that's a cool thing. I also was told that during surgery, you can tell if your patient is in pain, so you could administer pain medicine during the surgery. One problem that you kind of have to be aware of is to not give pain meds towards the end of the surgery, or else it'll be harder for the patient to wake up. One interesting thing that I didn't really know is that the CRNA helps bring the patient to the PACU. I kind of just thought it was like a pre-op thing, and then obviously maintenance during the surgery, and then that was it. But they extubate the patient, and then they bring the patient down to PACU, and then they do a handoff report to the PACU nurse. So that's cool. They have collaboration with the surgeon, the anesthesiologist. They work with the anesthesiologist mainly before the surgery, when they do the past history as well as drug allergies and any concerns, and then they work with the surgeon during the surgery and then PACU after the surgery. So there's a lot of collaboration going throughout the whole procedure, and it's very important that it's cohesive, and Eric did a great job listening to the surgeon, always being prompt and listening and doing what they needed. He also was very cohesive with all of the other healthcare workers that he had to work with. Their teamwork went very well, and it was great. They all worked very well together, and the surgeries went very smooth. So that was a very great experience. It was different from clinical because in clinical we're more hands-on and kind of tending to the patient before and after surgery, while this is taking care of the patient during surgery. And as a CRNA, you're not really doing hands-on things, you're monitoring things and then adjusting gas levels, etc. So it's more of observation and monitoring, as well as medication administration. So that was a really cool perspective to see compared to clinical, where we have more interaction with the patient, because as a CRNA they're asleep and you don't really talk to them except pre-op. So this was a very awesome experience overall. I got to learn so much. Some things I learned from lecture that they talked about, such as if they're having a heart attack, he talked about how you would give a beta blocker, morphine, and nitro, because you always have to monitor the heart rhythm. So there were a lot of things from lecture that I got to incorporate into this experience, as well as learning new things, and I got to see a new perspective compared from clinical and my other shadowing experiences. So this was a great experience overall, and I'm very grateful for Eric Toohey for showing me around.